Hi, it's Josh DeLucky here, doing a presentation on the Passionflower for Nursing 303. I use the sources Lexicon and the National Center for Complementary and Integrative Health to research the Passionflower. And I also did some quotes on the product from Amazon.com and Walmart.com. A brief history on the Passionflower. It was discovered in 1569 by Spanish explorers in Peru, who saw the flowers as symbolic of the Passion of Christ and a sign of Christ's approval of their efforts in their journey. The floral parts are thought to represent the elements of the crucifixion. 3 styles represent 3 nails, 5 stamens for 5 wounds. The ovary represents a hammer, the corona as the crown of thorns. The petals represent the 10 true apostles, and the white and bluish purple colors represent purity in the kingdom of heaven. This flower is a native to southeastern parts of the United States and Central and South America. In the U.S., you can find it from Virginia to Florida and as far west as Missouri and Texas. Currently, the Passionflower is approved or safe for use by the FDA. So it's considered safe for the most part. Initially, it was used in Europe for homeopathic or folk medicine use to treat pain, insomnia, and hysteria, and also nervous exhaustion. It also has been used for bronchial disorders, asthma, which I'll get into a little more detail later, inflammation, hemorrhoids, treatment of burns, and attention deficit disorders, along with giving to people preoperatively or pre-procedures to help with anxiety related to those procedures and operations. The Passionflower is got a couple of contraindications for use. You don't want to use it if you're pregnant. And anyone with any cardiac issues should not use it because it can cause prolongation of the QT interval. It also should not be used if you're taking antipsychotic medications or any other medications that can prolongate that QT interval because that would put you at risk. There is theoretically a suggestion to not use it if you're taking anticoagulants due to the risk for prolonged bleeding. Caution is recommended also when used in conjunction with central nervous system medicine due to the agonistic effects on the benzodiazepine receptors. There have been some adverse effects reported on the herb, such as nausea, vomiting, dizziness, confusion, ataxia, drowsiness, and again, the cardiac arrhythmias concern. There's hypersensitivity, environmental, maybe being around the flower, sniffing it can cause a stuffy nose, and some asthma as well. There's some hypersensitivity from just being around the flower as well. There has been some species of the Passionflower that when ingested, these species, it can exhibit genotoxicity. And there is no information that I could find anywhere about specific diets and contraindications of ingesting the flower and eating certain foods. It has been studied on rats, mice, and humans, but mainly the findings of the studies have been inconclusive. However, there are a few key points on its helpfulness that should be mentioned. In a clinical study of purple passion fruit peel extract, a reduction in pain and stiffness was shown in these adults with osteoarthritis of the knee. It was evaluated in a randomized double-blind placebo-controlled study of the purple passion fruit peel extract at 150 milligrams daily for 4 weeks, noting a significant reduction in coughing, wheezing, and shortness of breath in patients with asthma. As already noted, it does have an impact on the benzodiazepine receptors, making it helpful for reducing anxiety. This is predominantly the use for it, is to treating anxiety. So according to the Cochrane Review database, there aren't enough clinical trials, available on its effects to provide a recommendation on therapy for anxiety. However, the trials did speak to a few elements on its influence preoperatively for anxiety, claiming that if you take a 260 milligram pill 30 minutes before oral surgery, it diminished anxiety similar to Versed. And if you take 20 drops of the elixir, Passionflower extract, the night before and the morning of dental procedures, it also demonstrated a reduction in anxiety as well there. 1,000 milligram tablets given 1 hour before elective surgery was associated with a reduction in anxiety similar to that of melatonin. It has also been noted to cause cognitive impairment, which is a little more severe with the use of the Passionflower as opposed to the melatonin. An interesting fact with the Passionflower is it was used in conjunction with clonidine to treat opiate withdrawal symptoms. And when it was used in conjunction with clonidine, it had a pretty significant improvement with the mental scores of those patients, opposed to those that just were on clonidine alone during the opiate withdrawal. So according to Lexicon, the traditional dosing of Passionflower for mild sedative effects, again, that predominant use of the Passionflower for anxiety, is to use it at 0.5 grams to 2 grams. In the Cochrane reviews, however, though, the dosages that they cited for use for anxiety were 45 drops daily. That was one of them, or 90 milligram tablets. So this kind of leaves us in a tough place with providing some guidance on dosing for treatment of anxiety. What dose are you going to use? Because then there was another trial that used 1,000 milligram tablets, another one 260. So there's some discrepancy there. You can purchase 60 500 milligram tablets on Walmart.com for $6.81. That's a quote recently. And you can also purchase 60 tablets of the 1,000 milligrams at Amazon.com for $7.21, which probably would be a better deal if you get more bang for your buck there. Or you could get a 4-ounce bottle of the elixir with a dropper. It's available at Amazon.com for about $27. So these sightings, the sources are on the description. So if you want to go to that, you can. That's all I got on the Passionflower. Hope you enjoyed the presentation. Thank you.